And thank you everybody for joining us today. It's great to be back here with Dr. Hanley and with Mary on the traditional territory of the Kwanlin Dun First Nation and Onquatchin Council. I'm starting with a somber note. Today is the National Day of Mourning. It's an important opportunity to remember and to honor those who have been injured, contracted an illness, or died in the workplace. Yesterday, we heard the devastating news that a placer miner died while working in the Black Hills Creek area. This is a truly tragic event. Our condolences go out to the deceased man's family, friends, co-workers, and loved ones. Most Yukoners know that the placer community is a very tight-knit community, tight-knit family, really, and this news is absolutely devastating. My thoughts are with everybody that are grieving in the Klondike right now. We need to hold each other up and we need to support one another, as always. I want to thank all those who are working in the front lines in our healthcare system, here in the territory and across the country. This is not easy work. Many healthcare workers across the country have contracted COVID-19 in the past year, and some have even died doing their duty. It was also announced this week that a second Yukoner lost their life in relation to COVID. While COVID-19 was not the cause of death, it was a contributing factor. Now, Dr. Hanley will have more to say about this situation in a moment, but on behalf of all Yukoners, I send out my sincerest condolences to the friends and families of the individual. This is sad news, and it is also a reminder that COVID-19 is a threat to the health and safety of all Yukoners, and we do still need to stay vigilant and take precautions. We remain vulnerable to this disease, and we know from events in other jurisdictions how quickly positive situations can change. Just yesterday, Nova Scotia announced 96 new cases. Iqaluit is dealing with its first outbreak and currently has 45 cases. The Northwest Territories is managing clusters of cases in Yellowknife with a high number of contacts. Ontario is continuing to deal with a very challenging situation with thousands of new cases each day and healthcare system being pushed to their limits. In light of what is happening across the country and around the world, I am once again feeling extremely fortunate and grateful to be here in the Yukon. We continue right now to have no active cases of COVID-19 in the territory. We are the only jurisdiction in Canada with no active cases. This would not be possible without the tremendous efforts of Yukoners to protect not only themselves, but their communities. So again, thank you very much to all the Yukoners that are leading by example by taking the COVID vaccine. More than 72% of eligible Yukoners now have received their first shot, and a full 63% have received their second shot. This is absolutely fantastic, but we do need to keep going. You can still get a shot, and I strongly encourage anyone who has not yet received a vaccine to please book an appointment. The clinic here in Whitehorse is still booking appointments for first and second shots, and they are accepting drop-ins during the weekdays. You can book appointments online at yukon.ca/thisisOurShot. You can also phone the phone line, which is 1-877-374-0425 if you need assistance. If you live in one of the communities and if you are unable to attend the mobile clinics, please contact your local health care for more information to make an arrangement to get your shot. And again, I strongly encourage all eligible Yukoners to book an appointment and get immunized. The vaccine is crucial to getting us all through this pandemic and returning to normal. As we wait for the vaccine rollout in other parts of the country to catch up to what we have here, it's also essential that we continue to practice the Safe 6+1. I know it's difficult, especially with spring in the air. Everyone is a little bit restless and tired of restrictions. We all want to reconnect with friends and family. It's important to recognize that we need to connect socially, but it's also equally important to do so safely, and that we can minimize the risk of importing the spread of COVID-19 to those who are vulnerable if we all continue to do what we've been doing for 13 months now, which is maintaining the Safe 6, also practicing, wearing a mask when you cannot maintain physical distancing, including when you gather outside. Wearing a mask is a very small action that you can take that makes a huge difference when it comes to containing the spread of COVID-19. Please continue to mask up and to keep our territory safe. And thank you, everybody, for continuing your diligence. In the past week, 4 charges have been laid under the Civil Emergency Measures Act. All 4 are for failing to self-isolate. This is very disappointing to hear. With no active cases, the highest risk right now for Yukon is the importation of COVID-19. So with that in mind, I do want to thank our CIMA enforcement officers and our partners with the RCMP who continue to investigate complaints. Again, recent events show how quickly things can change when it comes to COVID-19. We have no cases today, but we could have an outbreak tomorrow, especially with the increasing numbers of variants of concern across the country. No one wants this to happen, and the best thing we can do to prevent this from happening, again, is to practice the Safe 6, to mask up, and also get your shot. So please keep it up, Yukoners. We've come so very far together. We are an amazing community in a global pandemic, and we need to dig deep and we need to keep going. Our government is here to provide those supports. Those supports are ongoing for individuals and for businesses, and they will continue to be there. The COVID-19 relief programs that our government introduced last year, they're still available, including paid sick leave rebates for employers who have, and also for those who are self-employed as well. You can find information about these programs at yukon.ca. The opening of our territorial campgrounds this weekend is a sign of good things and brighter days ahead. I know that the recent weather, Yukoners are absolutely anxious to spend some time outside, including myself. It is definitely good for our mental health to get outside and to enjoy some recreational activities. In recent days, Dr. Hanley and I have been in conversations about the COVID-19 situation around the country and here at home. We've had some very serious conversations about the risk of importation and what an acceptable level of risk may be now that Yukoners are vaccinated. Of course, these conversations are all leading to what steps we can take to ease restrictions that have been in place for the last 15 months. While we're not in a position today to announce just what measures will be changing, we are looking at how we can ease self-isolation requirements in the near future, perhaps similar to what we have seen in the Northwest Territories. And as barbecue season and wedding season approaches, we are looking at the possibility of increasing sizes of gatherings. Again, these changes are only possible because of the response that Yukoners have had to getting vaccinated. As Dr. Hanley and others have said, vaccinating is one of our best weapons against COVID-19 and key also towards lifting restrictions. Despite increased activity in southern Canada, we are seeing the impacts of vaccines starting to be felt. So again, if you haven't had your shot, please book an appointment. It's so very important for expediting the lifting of these restrictions. If you have questions about the vaccine, please, please look up the information at yukon.ca and have a conversation with your doctor or with your local nurse. The Moderna vaccine is safe and effective, and it absolutely is saving lives. Again, I can't say it enough. Thank you, Yukoners, for your diligence over the last 15 months. And I'll conclude by saying what I usually say at this time, check in with each other, make sure you're kind and patient to each other, be excellent to everybody, and keep up the good work. Thank you very much. Dr. Hanley?
Thank you, Premier Silver. Good morning, bonjour. On this day of mourning, I also, like the Premier, want to offer my condolences to the placer miner from the Klondike who died on the job. And at the same time, my sympathies go to the family of Yukon's most recently identified case of COVID-19. Our most recent case was a Yukon resident who contracted COVID-19 while out of the territory. We announced this case on Monday afternoon. Unfortunately, the individual died from other health conditions. although the individual died with COVID-19, the main cause of death was not COVID-19. And my heart goes out to the family and friends of this individual. For those seeking more information, please remember, we will not release any further information in regards to this death to protect the privacy of the family at this difficult time. While people may want to know, they don't need to know. And remember how important understanding and compassion is at a time like this. I hope everyone has been able to enjoy the beautiful weather we have had recently. It's the small and simple things we do that can help us remember that there is a world beyond COVID-19. I know these weekly updates of late have focused rather heavily on variants and their rapid spread in Canada and what that means for us. It's my role to ensure that Yukoners continue to be informed and aware of not only what's happening in Yukon, but across the country. Provinces and territories alike are trying to contain the ongoing surge of COVID-19 cases, with lockdowns and restrictions coming into effect day by day. The pandemic continues to rapidly change as we enter into warmer months. We have, as the Premier said, witnessed Nunavut and Nova Scotia being hit hard once again by COVID-19. Iqaluit, the only capital city to not have had a single COVID case for the first 13 months of this pandemic, now has reported 45 cases as of yesterday. As the Premier mentioned, these recent examples show us once again how quickly our situation can change if we let our guard down. In a matter of days, we have seen jurisdictions across the country impose new measures and restrictions to contain rapidly rising numbers of cases. Along with the COVID-19 surge in much of Canada, we have seen recent case importations here, and we're likely to see more. So now it is more important than ever for people who come to Yukon from anywhere else to self-isolate, and with meticulous attention to detail. Variants will take any opportunity to find someone else to infect. If you isolate with others in a household, then they must self-isolate too. If we all do what it takes to keep us all safe, then we can continue to avoid transmission within Yukon. I'm grateful that we have no active cases in Yukon, and each person vaccinated decreases the risk of spread. We continue to make progress in our vaccination campaign as variants continue to challenge most of the country with high caseloads, hospital and ICU admissions. Vaccines are our best tool to stop the possibility of importation and transmission of variants as best as we can. And right now, our best way to do this is to get vaccinated as soon as possible and self-isolate as necessary. As of end of day yesterday, we had administered 25,713 first doses, 22,032 second doses. Since the wrap-up of third visits to the communities, plans are now in place to support ongoing rural vaccination by placing Moderna vaccine in the community health centres. The mass clinic at the Convention Centre in Whitehorse begins reduced hours beginning next week. The clinic will no longer be open on Saturdays or Mondays, and hours will change for Tuesday through Friday. Appointments will still be available and walk-ins still welcome, but only during certain times. The new information will, of course, be available on the website. It's exciting to see the numbers steadily rise week after week, and without Yukoners' efforts, we may not be in our current position of having 63% of our eligible adult population fully vaccinated. I think many of us would agree this is a fantastic accomplishment. There's one thing I wanted to point out about vaccine bookings that recently came to my attention. On several occasions, people have been booking vaccine appointments and not showing up. I want to make sure that people realize the impact this has on our vaccine program and supply. This isn't quite the same as, say, missing a rendezvous with a friend. Keep in mind that Moderna vaccine is kept frozen at -20 degrees. When you book an appointment, our team of immunizers thaw a set number of vials. The dose needs to be used within that day, or it has to be thrown out. Our team is very careful to thaw just the right amount so we don't waste a single dose. However, if a large number of people do not show up, then many doses may need to be discarded. So if you book, please show up. And please, if you can't make your appointment, we totally understand. But please do contact our team, cancel your appointment, or reschedule it. At a time when there's widespread need for vaccine across Canada and indeed around the world, we need to be so careful with each dose we use here in Yukon. Speaking of bookings, I am hearing some stories of people who are holding back on seeing the doctor or nurse because they think they need a test first. Now, it is important to note, first of all, that getting a test is very much what you should do if you have any symptoms that might be from COVID. Remember that fever, cough, difficulty breathing, and loss of taste and smell are common first symptoms of COVID, and that there are many other possible symptoms as well. If you're experiencing new symptoms, then you should take the online assessment or call 811 to get testing advice. If you have a medical problem that you want to see a doctor or nurse for, you should definitely go ahead and make the appointment. You will be asked some screening questions to determine your risk for COVID illness. A test may be requested first if you do have COVID-like or flu-like symptoms. Sometimes the visit will be by telephone or a virtual visit. Sometimes you will be seen in person. But you should always be able to get the care that you need. The Yukon Medical Association, with support from Yukon government, has a campaign called Don't Put Your Health on Hold, with many Q's and A's about visiting your doctor. Please check out their website at yukondoctors.ca. Well, it only takes a glance at the news these days to get the picture of where Canada is with COVID. With the surge in much of the country and new lockdowns and overwhelmed hospitals, the path ahead for us looks rocky and uncertain. There have been many bumps in the road so far, and we certainly did not anticipate all of them. And I do get it, we are tired. On the other hand, let's consider a few things. The COVID measures in place work well. Each of us needs to keep that in mind and keep going for now. Our response to each challenge that we have faced over the last 15 months has also worked, and we are continuing to do our part to respond with science, evidence, and common sense, while doing our best to keep society open as possible. Stepwise and together we have made great progress, and we will continue to do so. Vaccination will help us get us to where we need to go, and we are not far away. Remember two ways that vaccine protects us. When people have complete vaccination, those individuals are protected from disease and from severe outcomes. When a large portion of the population are completely vaccinated, then we prevent transmission and community spread. Many have asked me if 75% of population uptake is equal to herd immunity. And I'd say this. 75% uptake amongst our eligible population was our first goal, and we are close, but not quite there. If we look at our numbers by age category, we have 86% of those aged 70 plus have had 2 doses. 76% of those 60 to 69 have had 2 doses. 65% of those aged 50 to 59, 62% of those aged 40 to 49, 56% of those aged 30 to 39, and last and certainly not least, 44% of those aged 18 to 29 have received both doses of vaccine. 75% uptake would be best if it were even across all age groups, and including kids when we get there. There is no one number that we know of for herd immunity. It depends on too many things. However, the more people vaccinated, the better off we will be able to do the things we will like to do. We will learn more about the ideal percentage uptake as we go. For the time being, the answer is the more, the better. 75% across all age groups would be fantastic. So Yukoners, if you are not yet vaccinated, then please get the shot. So what is ahead of us as we look to spring and summer? And the Premier talked about that, and I have talked recently in recent media occasions that summer will bring some easing of restrictions. And I would say we are still on course for some significant changes, which I hope we will be able to bring to you soon. I know, as many of you may be struggling with the amount of time we've been enduring this pandemic, and it has lasted longer than many people expected. But I want to remind you all that we are looking ahead for what is to come in the next few months. While watching and evaluating the variants, tracking and encouraging vaccine uptake, we have also been reviewing and planning our path forward next steps. As we see vaccination rates continue to rise, we can feel more and more confident in our ability to reduce the threat from this virus. As always, our steps will be measured, and we will not rush. Even as we ease restrictions, we need to be aware that vulnerability remains, and this virus will be looking for openings to infect and to spread, whether that is in gatherings, in households, in workplaces, or other settings where unvaccinated individuals or groups may offer up opportunities. So stay with us, Yukoners. We will see change shortly. In order to be successful with easing restrictions, we do need to ensure our foundation is strengthened to maintain and protect the health of all Yukoners. That means ongoing vaccination and careful observance of self-isolation measures, particularly within households, to prevent transmission. It also means continuing to abide with the public health measures that the Premier mentioned. We all need to stay the course, to wash our hands, to keep physical distance, to stay home when sick, and to use masks in indoor public settings, and to get our 2 doses of vaccine. Before I pass back to Pat, I want to mention a week that is very special to me, particularly this year, and that is National Immunization Awareness Week. This is an annual event that is held to highlight and recognize the importance of immunization. This week aims to promote the use of vaccines to help protect people of all ages against disease. We've seen time and time again over the past decades that immunization saves millions of lives every year and is one of the world's most successful public health interventions. This year it may hit home for more than the usual number of people. As many of us are planning to or have received the COVID-19 vaccine, National Immunization Week is an important time to reflect on how far we have come in such a short time with vaccines and the importance of vaccines in our current situation. So in honor of this week, let's also recognize the great efforts of our healthcare professionals who are going to great lengths to immunize Yukoners throughout the territory. Their managers and leaders and support staff, logistics and IT that are helping schedule, check people in, clean and help run everything so smoothly. We're extremely grateful for all of our hard work as you continue to immunize fellow Yukoners. Immunization is more than just COVID, of course, and a big focus for community nursing over the spring and summer weeks here are to run the school children's HPV immunization program, attend to catching up kids with the Tdap, or tetanus, diphtheria, and pertussis immunization, the pre-kindergarten vaccines and other vaccines, and look after adults eligible for vaccines such as pneumococcal vaccine and the shingles vaccine. So that's it for today. Stay well, and let us together be grateful for all we have in Yukon. We're doing well, and we have reached another Yukon spring. Summer is only a few weeks away. Notice what's good in your life, and take care of each other. Thank you. Merci cho. Merci.
Thank you both. We'll now move to questions from reporters, and we'll begin with Jackie Hong, CBC.
Hello. My first question is for Dr. Hanley. Part of the role of public health is to share timely and accurate information with the public, and this is particularly important given how fast misinformation can spread in the internet age. And unfortunately, we did see rumors and speculation spread Monday after the announcement of the second COVID-related death. I'm wondering if that press release met your standards.
So thanks, Jackie, for that question, and it's a really important question. I have always committed to getting important information out to the community as soon as we can turn it around when there is public health risk. And that I think has been illustrated by our public notification processes, and how we when we identify a public risk, we do everything we can to get that information out in as timely a way as possible. So there is always a compromise between speed and accuracy. Going too fast and getting inaccurate information, of course, can be detrimental. So it's recognizing that we need to gather the information, we need to get the story, we need to contact if there are, for instance, public venues that they need to know first. So we need to do a lot of background before we come out with public information. There is also a need to communicate with transparency. Significant events, such as the recent person who died with COVID infection, and that also was in as timely as a way we could manage, while getting the story, determining if there is any risk, public health risk, and connecting with the family. And those things take time. When we recognize that there is no public health or exposure risk, then that certainly lessens the need for speed, and it increases the need for respect, consultation with family, and the need to protect confidentiality. So I do think in that case that it met the standard that we need. We needed to have this individual counted as one of our cases, and unfortunately as one of our deaths, but put in the right amount of explanation to explain why this individual did not die of COVID, and why to us that was important to point out. So I think we put that all in with as fast a turnaround as we could, and with as much information as we felt was necessary to portray the point. Thank you.
Do you have a second question, Jackie?
I do. This is for the Premier, although Dr. Hanley, of course, you're welcome to answer as well. One of the keystones for the Liberal re-election platform was increasing rapid testing, and CBC yesterday reported that Yukon is one of 3 jurisdictions who hadn't reported back to the federal government with regards to how many rapid tests it had used. I'm wondering when the Yukon will see the promised ramp up in rapid testing, and when we'll start seeing numbers and results in regards to how many tests were used, and positive, negative, et cetera.
Yeah, I think Dr. Hanley can talk more specifically about how we're using our testing right now. But what I can say is that the CDC, the Communicable Disease Centers folks, have done a remarkable job of our tracing of the folks that have vaccine or family members or contact tracing. So we've really done a great job in being able to contain the virus, and so now we're looking at other ways of using our rapid tests. I would say as well, it's only been a few couple months now where the efficacy of these tests are at a rate where we're not seeing the false negatives, the false positives. That's really going to allow us to start using these tests in expanded different ways. So I know that we've been working with mining companies, we've been working with other individuals to utilize these rapid tests, and as that efficacy gets better, we now have more opportunities for it. So if you're asking about why there's a lag in us getting back to the federal government, I don't think there is. At the Council of the Federation, the First Minister's calls, we talk always about the tests and the need, and right now, as Yukon's sitting with no cases, and and we've used other tools in our toolbox where other jurisdictions with bigger populations would have to do more of that testing. But we've done a very good job with the communicable disease folks to maintain low numbers and to make sure that the tracing, and that's the really most important piece here, that the tracing has been done, and they've done a remarkable job of that.
Yeah, I'm happy to add some comments. I think the Premier spoke well to the point that testing is one of the tools, and it certainly isn't the only tool. And I think it's always important as we look at increasing testing capacity to remember where testing fits into our overall strategy. And we also have to remember that we are in a containment mode. And we have successfully done that, even with testing rates that are relatively low compared to other jurisdictions. We've always maintained a very good testing capacity, a very good testing turnaround time, with solid partnership with BC, and that really is the foundation of our testing strategy. We are using increasingly now, incrementally, we're using rapid testing for screening, what we call screening, where we're looking for disease in people who might be at higher risk for COVID, and looking for it early before it becomes detectable. And we are gradually increasing the application of that screening testing. Those screening test results are not reflected in the numbers that are on the website, the numbers on the website reflect symptomatic testing again, which is the core strategy of a core part of our strategy. So screening testing, for example, applies. We have a program where we use the rapid testing, the Abbott ID testing, for people regularly going in and out of the territory, starting with some of our flight crews. And we have also used screening testing, as the Premier mentions, for people going out in and out of mines, and we're looking at these other areas for suitability for using that screening test, using it as a screening tool. We do have Abbott IDs. We do have a lot of Abbott IDs in territory, and those machines, and so we do anticipate gradually having those in communities ready for usage for if there's surge, if there are for early identification of symptomatic cases as an additional tool. But keep in mind that we already have good capacity to test in communities. We have community transport when we need priority turnaround times for rural Yukon. We have all of those pathways mapped out. So I think anything that we add in terms of rapid testing is in addition to the foundation. I think that the strong testing approach that we already have, and we are gradually and incrementally, and I would say with a lot of good quality control, in increasing it. What I have seen sometimes in other areas is that people, with all the best intentions, sometimes going out too fast with testing technology, and the technology gets ahead of the goal, and therefore the value there becomes very little added value of the testing. And so I think we have to make sure, what is our goal, what do we want to achieve, and how do we use that technology to achieve the goals that we want, rather than the technology itself dictating the usage.
Do you actually have a number for how many rapid tests have been used in the Yukon? Like, is that tracked separately from the tests that go down to BC?
We do. I don't have the number in my head, but we do have tracks. We can get at least some ballpark number to you.
Thank you.
Thank you. We'll move now to Luke, CKRW.
Hi, I have a question for Premier Silver. I'm just curious where the territory is at now with vaccine supply, and whether the government is looking at acquiring more vaccines throughout the spring and summer months, just given the fact that there will be students returning and seasonal workers and people like that.
I think actually Dr. Hanley might be better suited to answer that question. Again, we've made good with the commitment for the first 3 months to have 75% of our adult population and vaccinated, and we are seeing increases in both Pfizer and Moderna and other vaccines right across the nation, and now turning our attention to trials when it comes to Pfizer's has some trials for some of the younger population, and Moderna would be quickly after that, I assume, but those are conversations for the good doctor, not me.
Thanks. Yeah, I can certainly. I feel very confident in supplies. We have, of course, the incoming Moderna supplies. There, although we did have a cut in the April allotment, it has not affected our estimates for our ongoing rollout, and that includes the extra doses that we had requested for non-Yukon residents who work here, such as mine workers and other seasonal workers, and we've done a lot of work with the mines and with other areas where people come in for seasonal work, placer miners as well, for example. So that's going well. We also have, to the question of students, of course, we have now a special program temporarily for incoming students and young seasonal workers to make sure they have access to vaccine even while in self-isolation. We have the supplies for that. And as we look forward in the months ahead to vaccine for children, we also will be, we don't have numbers for that yet. We know how many kids we will be immunizing, but we don't have the numbers, but that will come with time. I'm completely confident, especially as you see the projections for the mRNA vaccines over the weeks to come through the rest of spring and summer. We will have ongoing access to all the vaccine that we need.
Thank you. Do you have a second question, Luke?
I do have a question for Dr. Hanley. I want to know what the risk of transmission is between somebody who is fully vaccinated and somebody who hasn't received a vaccine yet. I'm just curious about what we know about that.
Yeah, that's a very good question. And that, of course, is a question that we are all keenly interested in. And I think we're seeing more and more information coming in, particularly for the Pfizer and the mRNA vaccines on protection, high protection against asymptomatic infection. And which means if you can protect against asymptomatic infection, then you're also protecting against transmission from one to another. So very, very encouraging results. So these are studies, for instance, carried out in Israel in combination with Pfizer. There's the clinical trial data itself, limited information there. CDC has talked about studies in healthcare workers in the U.S. So there have been now a number of these smaller studies, all kind of pointing us in the same direction, that we're increasingly confident of the ability of the vaccines to prevent asymptomatic infection. There is less information on the AstraZeneca vaccine, probably just because of a lot of it because of the information that we have from the U.S. and from Israel, but other areas where mRNAs got out of the gate earlier. But they're all looking good for the very important effect of vaccines in prevention of transmission.
Thank you. We'll move now to Haley, Yukon News.
Thank you. Question for Dr. Hanley. The situation you mentioned where people are booking vaccination appointments and then not showing up, I'm curious if that's resulted in any vaccine doses being wasted, and wondering if the territory is tracking that number.
Yeah, we are tracking the number. I don't have the number for you. I know there were several wasted on one occasion, several doses wasted on one occasion. I believe it was most of one vial containing 10 doses. But I don't have the exact numbers of wastage. I know that overall we have a very, very low percentage of wastage just because of that ongoing careful attention to how vials are used. But it's another number that we can obtain and bring back.
Thank you. Another question, Haley?
Thank you. Yes, my other question involves the second wave that's currently taking place in the south. I'm wondering if a second wave in British Columbia is having an impact on the health care that's available to Yukoners, if there are procedures being delayed, that type of thing, if you could speak to that.
Yeah, and I think they call it I think they're calling it the third wave, recognizing that this is an entirely new wave that has hit BC and the rest of the country. So this is again, it's a good question about how this may affect access to health care. It is something that we have been re-engaging with our partners in BC to ensure. But so far so good. I have not heard of any issues with delayed or cancelled appointments. We still have regular medical transfers when required, so that I think that capacity is still there, and we still have assurance of that availability. But it is something that we continue to check in on with our partners.
Thank you. We'll now move to Tim, Whitehorse Star.
Yes, good morning. My first question is for the Premier, most likely anyway. With some growing agitation in the Mackenzie Delta region of the Northwest Territories to essentially strike up a travel bubble with the Yukon, is that something that the Yukon's interested in? I know from having lived up in that area for 3 years, they really think of themselves more as Yukoners than members of the Northwest Territory, and certainly have more affinity for here.
Yeah, it's a great question. I know that the two doctors, the two medical officers, both here in Northwest and in Northwest Territories, have been working on conditions and a situation where we would see some increased mobility there for sure. It's something that we're continuing to work on, and I'm very confident that we'll have an announcement within the very near future on what we can do. I agree. You know, there's a lot of family connections. You can imagine in my community of Dawson City, Old Crow, also Fort McPherson. There's family, throughout the Gwich'in families, and people are getting a little restless and want to see nieces and nephews that are on the other side of a border that a lot of these Indigenous folks don't see, and so we're working with Northwest Territories to work safely to make sure that we can allow families to gather, and that's something that we've been talking about since I got back into this chair, and we'll have some more information on that in very near due time.
Thank you. Do you have a second question, Tim?
Yes, this one is more for Dr. Hanley. I think it's kind of an obvious one. You mentioned earlier in this briefing about how what you would like to see is a 75% vaccination rate across age ranges instead of just a general 75% vaccination rate. What are you going to say to the people who are inevitably complain that you've moved the goalpost?
I'm trying to think of what goalposts I've moved. So we have talked about 75% as a goal from the beginning, and remembering that was based on the allocation that we had, where we had the allocation from the federal government to cover 75% of the population, so we have recognized that probably roughly equates to what was called herd immunity, but it has become a much more difficult. I mean, the reality is that it's difficult to know. It always has been difficult to know what that number is, and particularly in the face of variants, it's difficult to know what that kind of magic number is. And if you think of some of the variables like unvaccinated populations so far, like children, if you think of incoming, the more people that come in who may not have vaccine, the more that adds to an unvaccinated population, as well as what is the mix of variants and knowing the increased transmissibility of variants. So we still have to kind of work with those uncertain variables, but having uniform uptake, I think, has always been a goal. The more that we could get that 75% across the board, that obviously that is going to protect us. If we think of a lower that sort of 50%, roughly 50, I think 58% first dose, 44% second dose for the young people. Where are we seeing transmission occurring in Canada, in the rest of Canada, amongst what age groups? It's precisely amongst the younger adult, the mobile age groups where we see spread. So why would we not want to see as high uptake amongst younger adults as we see in the older age groups? It only makes sense. So I don't see this as moving goalposts. I think it's perhaps trying to better define the goalposts as we go along based on what we learn and what we know. One thing is clear: the higher the better, and the more we have our population vaccinated, the more confident we can be, the bolder we can be with our opening up measures. And the last part I'll say is, it's great to see 90% in uptake, or getting towards that 90% in our elders, who are clearly the most vulnerable. And it comes back to that. The individual reason for vaccinating people is to have individuals vaccinated from disease, and particularly from severe disease. And it's very gratifying to see that uptake, the high uptake that we're seeing. But that does not let the younger people off the hook. What we don't want to see is that the older people taking that kind of 75% away from the younger people. That doesn't work that way, because we will see transmission amongst younger populations if we don't get them up to those high levels as well.
Premier Silver?
Yeah, I agree with everything that Dr. Hanley said. I'll just add that, that 75% number was always, when we were negotiating with the federal government for vaccines, what we believed as a nation would be the amount of uptake that we would get from a population, of an adult population. Never at any time was it that's going to be herd immunity. It was always, we believe that 3 out of 4 Yukoners and 3 out of 4 people would be ready, willing, and able in the adult population to receive the vaccination. And Yukoners are ahead of the curve in the rest of Canada as far as getting to those numbers. And so as we see these amazing results, I completely agree. It's good to quantify. And if we see certain parts of our population going over 75%, then it's, again, the reason why we're here today is to make mention of the fact that there are other areas that we need to do better in and make sure that the younger populations do have the vaccination. The good news as well is, as we continue the conversations with the federal government about supply, if we do have one portion of our population over that 75%, the good news is vaccines will be available as we try to get the rest of the population demographic, the age demographic, to a 75% goal line. So again, I don't see any changing the goal line, but I do see is the filling in of information as we get better and better at tackling this pandemic.
Thank you. We'll move now to Paul, CBC.
Hi, can you hear me okay?
Yes, we can.
Hello? Yes. Not sure if you can hear me. My question is for Dr. Hanley. 6 days ago, you announced 2 new cases in Whitehorse, cases 79 and 80, and said at the time that the source of infection was still under investigation. I'm wondering why we haven't heard anything more about that investigation, and how confident are you, or should we be, that these cases are not an indication of possible community spread?
Thanks for that question. So, yeah, those cases are recovered, and contact tracing was carried out, and those cases were linked to a previous case. So it took some time to tease that out, and I guess I omitted to cover that part in our notes today. But yes, that case was clearly linked to a previous case. And there were no other cases identified. There was, of course, the usual process of contact tracing, and there were those public notifications. We did have some testing occurring as a result of that, but no further cases. So I'm completely confident that there was no further spread associated with these cases.
Do you have another question, Paul?
I do, yeah, and this one would be for Dr. Hanley as well. Just referring to the case, the person who died that was announced this week, and presumably they were outside of the territory for medical care, and that's when they contracted the infection, which may or may not have contributed to their death. I'm just wondering if there is risk of infection when people are sent out of the territory for medical care, does that change the decision-making process or considerations just around sending people outside of the territory for medical care, maybe to areas where, we're seeing a third wave or much higher infection rates?
Yeah, thanks. That's a good question. Of course, there are always those considerations of risks associated with care. I think all we can say, again, is it's important to point out that this person had an illness, an underlying illness, which ultimately resulted in the death, and the COVID infection made, at best, a minor contribution. So that is a risk. We know that in medical settings, that COVID transmission has at times been documented. There have been, of course, very early on, in particular, long-term care outbreaks. There have been hospital outbreaks, and it is a risk. But on the other hand, these outbreaks have been really very uncommon, and overall, the adherence to protocols has worked very well to prevent transmission of COVID within medical settings. There are always risks to care in specialized centers, in hospitals and tertiary care. There's the risk of secondary infections occurring, or hospital-acquired infections. There's a risk of adverse outcomes. And so I think that there are risks associated with transport. That should always be a risk-based conversation. But the reality is that there is always a need for specialized care in tertiary care centers, and most of the outcomes are very good. We continue to have excellent partnerships with some of the best medical care in the country for our Yukon citizens, and I would continue to be very confident in those processes. This was an unfortunate event, but it should not prevent anyone from accessing the medical care that's needed when the referrals are made for tertiary care with our partners down south.
Thank you. We'll move to Claudiane, Radio Canada.
I'll start with the Premier. So your cabinet hasn't been sworn in yet, so I'm just curious, and there is pressure to go back. Budget has not passed. So how is the government able to manage the pandemic right now?
The same way we have for the last 14 months, all the way through the election period. There was always the ability to move on any of the recommendations. It was very a lot of synergies of a lot of epidemiology in other jurisdictions. Stopping any recommendations really coming our way. But it is business as usual. I am still the Premier, and we still have the ability for cabinet management board submissions, and those are happening. We've been having conversations with the opposition. We are planning to get sworn into new roles very soon. There's always a period of time between elections and swearing in. The last minority government that was sworn in took 57 days after the election, and the one before that took 48 days. Even the last Yukon party government, a majority government in 2011, took 25 days in between. So the election was just a little bit over 2 weeks ago, and we will be quicker than that. Let's just say that.
Thank you. Do you have a second question, Claudiane?
Yeah, I would, but I need my translation. So I'll go to Dr. Hanley. Est-il possible de m'expliquer en français, donc, pour les fins de la radio, la problématique là, que vous avez évoquée par rapport aux gens au Yukon qui ratent leur rendez-vous pour la vaccination? Qu'est-ce que ça a comme implication? Et oui, s'il vous plaît, j'aimerais aussi avoir les nombres de doses qui ont été jetées en conséquence.
So, Dr. Hanley, could you please repeat in French, what are the consequences and the problem of people missing their appointment for vaccination? And can you also provide the number of doses that might have been spoiled by this practice?
Salut, bonjour. Merci pour la question. Il s'agit le vaccin et la problématique, c'est que on peut perdre les doses de vaccin si les individuels viennent pas pour leur rendez-vous. Et c'est à cause de le fait que chaque conteneur de vaccin c'est maintenu congelé, donc c'est congelé à moins 20 degrés, et donc chaque 10 doses doit être décongelé avec pour avoir assez de temps pour donner aux 10 personnes. Donc, pour chaque 10 personnes, chaque dose, il faut avoir une bouteille de vaccin. Donc, si quelqu'un vient pas, surtout si plusieurs personnes viennent pas pour le rendez-vous, on n'a pas un choix. On peut pas récongeler les doses. Il faut jeter les doses au fin de la journée. Donc, si on vient pas pour le rendez-vous, ça peut terminer avec une perte de doses. Et donc c'est pour ça il faut attention au garder le rendez-vous ou téléphoner et annuler le rendez-vous ou choisir un autre pour empêcher que les doses sont perdues. Pour le nombre de combien, j'ai pas le nombre de combien de doses. Je sais qu'on a entretenu un très très bas pourcentage de doses, moins d'1% de doses qui sont perdues. Donc, mais j'ai pas les chiffres exacts, mais on peut revenir avec les chiffres.
Merci. We'll move now to Laura Boréal.
Oui, ma question est pour M. Silva. Les territoires du Nord-Ouest ont choisi d'assouplir les mesures de quarantaine pour les personnes qui ont reçu leurs 2 vaccins. je me demandais si le Yukon envisage de faire des assouplissements similaires.
So the question is for the Premier. The Northwest Territories have decided to shorten their quarantine period for people who have received 2 doses, and I'm wondering if the Yukon is entertaining the same idea.
In a nutshell, yes, we're attaining a lot of different changes to our current procedures, but we have nothing to announce right now. Again, Dr. Hanley has been working with with all of the chief medical officers right across Canada, best practices, and being in the fortunate situation we are right now with 0 cases active and excellent numbers of vaccination, we are having some very promising conversations right now, but nothing new to announce at this point.